51. How should a nurse comfort a 2-year-old during an injection? A. Tell them to stop crying. B. Hold them and use a soothing voice. C. Leave them alone to self-soothe. D. Restrain without speaking. Answer. Hold them and use a soothing voice. Rationale. Holding and soothing reduce distress and build trust. Option B is correct. Options A, C, and D increase fear or neglect comfort. 52. Which finding indicates croup in a 3-year-old? A. Silent chest. B. Barking cough and stridor. C. Clear breath sounds. D. Normal voice. Answer. Barking cough and stridor. Rationale. Croup causes a barking cough and stridor from airway swelling. Option B is correct. Options A, C, and D suggest other conditions or normalcy. 53. What should a nurse teach parents to prevent dental caries in children? A. Offer sugary drinks at bedtime. B. Brush teeth twice daily with fluoride. C. Avoid all brushing until age 5. D. Use only water, no toothpaste. Answer. Brush teeth twice daily with fluoride. Rationale. Fluoride brushing prevents caries by strengthening enamel. Option B is correct. Options A, C, and D increase caries risk. 54. What is the priority action for a child with a foreign body airway obstruction? A. Give rescue breaths first. B. Perform Heimlich maneuver. C. Check pulse immediately. D. Wait for spontaneous coughing. Answer. Perform Heimlich maneuver. Rationale. The Heimlich dislodges the obstruction, restoring airway priority. Option B is correct. Option A is ineffective. Options C and D delay care. 55. How should a nurse position a child post-cleft palate repair? A. Prone with head down. B. Side-lying or supine with head up. C. Flat on stomach. D. Sitting fully upright. Answer. Side-lying or supine with head up. Rationale. Side-lying or supine with elevation protects the repair and aids breathing. Option B is correct. Options A, C, and D risk suture damage or airway issues. 56. Which vaccine protects against Haemophilus influenza type B, HIB? A. MMR. B. HIB vaccine. C. DTP. D. Varicella. Answer. HIB vaccine. Rationale. The HIB vaccine prevents HIB-related meningitis and pneumonia. Option B is correct. Options A, C, and D target other diseases. 57. What should a nurse do if a child's surgical incision shows pus? A. Ignore it if small. B. Notify MD and obtain culture. C. Apply pressure to drain it. D. Cover it without reporting. Answer. Notify MD and obtain culture. Rationale. Pus indicates infection. Notifying the MD and culturing guide treatment. Option B is correct. Options A, C, and D delay or worsen care. 58. What is a common psychosocial concern for a teen with chronic illness? A. Improved body image. B. Fear of being different from peers. C. Enhanced social skills. D. Better academic focus. Answer. Fear of being different from peers. Rationale. Teens with chronic illness often worry about peer acceptance due to their condition. Option B is correct. Options A, C, and D are unlikely during illness. 59. What should a nurse include in teaching after tonsillectomy? A. Resume hard foods day 1. B. Avoid coughing or blowing nose. C. Skip pain meds to toughen up. D. Gargle with salt water immediately. Answer. Avoid coughing or blowing nose. Rationale. Avoiding coughing/nose blowing prevents bleeding post-tonsillectomy. Option B is correct. Options A, C, and D risk harm or discomfort. 60. Which finding indicates hyperglycemia in a diabetic child? A. Shakiness and sweating. B. Increased thirst and urination. C. Cold, clammy skin. D. Improved alertness. Answer. Increased thirst and urination. Rationale. Hyperglycemia causes thirst and polyuria from high blood sugar. Option B is correct. Options A and C fit hypoglycemia. Option D is unrelated. 61. Which milestone should a nurse expect in a healthy 2-year-old child? A. Jumping with both feet. B. Riding a bicycle. C. Reading simple words. D. Solving puzzles with 20 pieces. Answer. Jumping with both feet. Rationale. At 2 years, children typically jump with both feet as gross motor skills develop. Option A is correct. Options B, C, and D are later milestones, 4 to 6 years. 62. What is the best way to assess respiratory status in an infant? A. Ask the infant to describe breathing. B. Observe chest movement and rate. C. Measure arm strength. D. Check skin color only. Answer. Observe chest movement and rate. Rationale. Observing chest movement and respiratory rate assesses breathing in nonverbal infants. Option B is correct. Options A, C, and D are unreliable or unrelated. 63. Which symptom suggests epiglottitis in a 4-year-old child? A. Mild cough and runny nose. B. Drooling and tripod position. C. Slight wheezing. D. Normal swallowing. Answer. Drooling and tripod position. Rationale. Epiglottitis causes drooling and tripod posture from airway obstruction, an emergency. Option B is correct. Options A, C, and D are less severe or normal. 64. When should a child receive their first HPV vaccine dose? A. 2 months. B. 11 to 12 years. C. 6 months. D. 18 months. Answer. 11 to 12 years. Rationale. The HPV vaccine starts at 11 to 12 years per CDC to prevent HPV-related cancers. Option B is correct. Options A, C, and D are incorrect timing. 65. How should a nurse administer ear drops to a 2-year-old child? A. Pull the ear up and back. B. Pull the ear down and back. C. Insert drops without pulling. D. Use adult positioning. Answer. Pull the ear down and back. Rationale. In children under 3, pulling the ear down and back straightens the canal for drops. Option B is correct. Option A is for older kids/adults. Options C and D are ineffective. 66. What is the best pain management for a child during a lumbar puncture? A. No pain relief needed. B. Topical anesthetic and distraction. C. Aspirin orally. D. Heat application only. Answer. Topical anesthetic and distraction. Rationale. Topical anesthetic numbs the site, and distraction eases anxiety. Option B is correct. Option A neglects pain. Option C risks bleeding. Option D is ineffective. 67. What should a nurse do first for a child post-cleft lip repair? A. Offer a bottle immediately. B. Assess suture line and breathing. C. Apply pressure to the site. D. Encourage crying to test repair. Answer. Assess suture line and breathing. Rationale. Assessing ensures no bleeding or airway issues post-repair. Option B is correct. Options A, C, and D risk damage or delay care. 68. What is the priority action for a child in hypovolemic shock? A. Give oral fluids immediately. B. Administer for fluid bolus. C. Check temperature first. D. Wait for lab results. Answer. Administer for fluid bolus. Rationale. For fluids, e.g., 20 milliliters per kilogram saline, restore volume in hypovolemic shock, a priority. Option B is correct. Option A is unsafe. Option C and D delay care. 69. How should a nurse address a parent's concern about developmental delay? A. Tell them it's normal variation. B. Suggest screening and observation. C. Ignore it as overreaction. D. Blame the parent's care. Answer. Suggest screening and observation. Rationale. Screening, e.g., ASQ, and monitoring address delays objectively. Option B is correct. Options A, C, and D. Dismiss or misjudge the concern. 70. What should a nurse do if a parent refuses a life-saving blood transfusion? A. Administer it anyway. B. Document refusal and seek legal consult. C. Convince them forcefully. D. Skip it without documentation. Answer: document refusal and seek legal consult. Rationale: nurses must document refusal and seek legal/ethical guidance for emergencies. Option B is correct. Options A, C, and D violate ethics or law. 71. What should a nurse teach parents to prevent poisoning in toddlers? A. Keep meds in low cabinets. B. Store chemicals out of reach. C. Leave cleaners on counters. D. Avoid locking cabinets. Answer: store chemicals out of reach. Rationale: storing toxins high or locked prevents toddler access, a key prevention. Option B is correct. Options A, C, and D increase poisoning risk. 72. Which finding indicates severe dehydration in an infant? A. Moist lips and good energy. B. Lethargy and sunken fontanelles. C. Normal urine output. D. Clear skin with no rash. Answer: lethargy and sunken fontanelles. Rationale: lethargy and sunken fontanelles signal severe fluid loss in infants. Option B is correct. Options A, C, and D suggest hydration or unrelated findings. 73. What is the priority action for a child with suspected ingested poison? A. Induce vomiting at home. B. Call poison control immediately. C. Give water to dilute it. D. Wait for symptoms to appear. Answer: call poison control immediately. Rationale: poison control provides expert guidance, the first step in poisoning. Option B is correct. Options A, C, and D risk harm or delay care. 74. Which developmental task should a nurse assess in a 7-year-old? A. Tying shoelaces independently. B. Skipping with one foot. C. Writing complex sentences. D. Abstract reasoning skills. Answer: tying shoelaces independently. Rationale: at 7, children master fine motor tasks like tying shoelaces. Option A is correct. Option B is earlier. Option C and D develop later, 8+ years. 75. What is the best way to explain an X-ray to a 6-year-old? A. Say it's a big camera for pictures. B. Use technical radiation terms. C. Tell them it's painful. D. Avoid explaining it. Answer: say it's a big camera for pictures. Rationale: simple, familiar terms like camera reduce fear in 6-year-olds. Option A is correct. Options B, C, and D confuse, scare, or neglect understanding. 76. Which condition requires contact precautions in a pediatric unit? A. RSV. B. MRSA infection. C. Pertussis. D. Measles. Answer: MRSA infection. Rationale: MRSA spreads via contact, requiring gloves and gowns. Option B is correct. Option A is droplet. Options C and D are droplet and airborne, respectively. 77. How should a nurse calculate 4 antibiotic dose for a 10 kilograms child? A. Use adult dose halved. B. Base it on weight, e.g., mg/kg. C. Give a standard child dose. D. Skip dose if unsure. Answer: base it on weight, e.g., mg/kg. Rationale: pediatric antibiotics, e.g., 20 milligrams per kilogram, are dosed by weight for accuracy. Option B is correct. Options A and C risk error. Option D neglects treatment. 78. What is a common complication of untreated RSV in infants? A. Improved breathing. B. Bronchiolitis or pneumonia. C. Increased appetite. D. Better sleep patterns. Answer: bronchiolitis or pneumonia. Rationale: RSV can progress to bronchiolitis or pneumonia in infants if untreated. Option B is correct. Options A, C, and D are not complications. 79. When should a child receive their meningococcal vaccine, MCV4? A. At birth. B. 2 months. C. 11 to 12 years. D. 6 months. Answer: 11 to 12 years. Rationale: MCV4 is given at 11 to 12 years per CDC to prevent meningococcal disease. Option C is correct. Options A, B, and D are incorrect timing. 80. What should a nurse assess first in a child with a suspected concussion? A. Hair condition. B. Level of consciousness and pupils. C. Skin temperature only. D. Leg strength only. Answer: level of consciousness and pupils. Rationale: LOC and pupil response assess brain injury severity in concussions. Option B is correct. Options A, C, and D are secondary or unrelated. 81. How should a nurse comfort a 5-year-old during a cast application? A. Tell them to stay still or else. B. Explain steps and offer a toy. C. Leave them alone to calm down. D. Restrain without talking. Answer: explain steps and offer a toy. Rationale: explanation and a toy reduce fear and engage the child. Option B is correct. Options A, C, and D increase anxiety or neglect comfort. 82. Which finding indicates intussusception in a 1-year-old? A. Steady weight gain. B. Current jelly stools and vomiting. C. Normal bowel sounds. D. Clear urine output. Answer: current jelly stools and vomiting. Rationale: intussusception causes bloody stools and vomiting from bowel obstruction. Option B is correct. Options A, C, and D suggest normalcy. 83. What should a nurse teach parents to prevent falls in toddlers? A. Leave stairs ungated. B. Use safety gates and supervise. C. Avoid furniture padding. D. Encourage climbing alone. Answer: use safety gates and supervise. Rationale: gates and supervision prevent toddler falls, a key safety measure. Option B is correct. Options A, C, and D increase fall risk. 84. What is the priority action for a child with diabetic ketoacidosis, DKA? A. Give oral glucose immediately. B. Administer 4 fluids and insulin. C. Check temperature first. D. Wait for blood sugar to drop. Answer: administer 4 fluids and insulin. Rationale: 4 fluids and insulin correct dehydration and hyperglycemia in DKA, a priority. Option B is correct. Option A worsens it. Options C and D delay care. 85. How should a nurse position a child post-hydrocephalus shunt placement? A. Flat on back, with head down. B. Head elevated on non-shunt side. C. Prone with legs raised. D. Sitting upright fully. Answer: head elevated on non-shunt side. Rationale: elevation on the non-shunt side promotes drainage and prevents pressure. Option B is correct. Options A, C, and D risk complications or discomfort. 86. Which vaccine protects against pneumococcal disease in children? A. PCV13 or PCV15. B. MMR. C. Varicella. D. DTaP. Answer: PCV13 or PCV15. Rationale: PCV13/PCV15 prevent pneumococcal infections like pneumonia. Option A is correct. Options B, C, and D target other diseases. 87. What should a nurse do if a child's wound shows dehiscence? A. Ignore it if small. B. Notify MD and keep sterile. C. Apply adhesive tape to close. D. Encourage movement over it. Answer: notify MD and keep sterile. Rationale: wound dehiscence requires MD intervention and sterility to prevent infection. Option B is correct. Options A, C, and D risk worsening or infection. 88. What is a common psychosocial issue for a hospitalized infant? A. Enhanced bonding with parents. B. Disruption of trust development. C. Improved sleep patterns. D. Better appetite. Answer: disruption of trust development. Rationale: hospitalization disrupts trust, Erickson stage, in infants from separation/stress. Option B is correct. Options A, C, and D are unlikely. 89. What should a nurse include in teaching after fracture cast placement? A. Soak cast in water daily. B. Check for swelling or numbness. C. Skip follow-up appointments. D. Apply heat to the cast. Answer: check for swelling or numbness. Rationale: monitoring swelling/numbness detects complications like compartment syndrome. Option B is correct. Options A, C, and D risk damage or neglect care. 90. Which finding indicates hypoglycemia in an infant? A. Warm, dry skin. B. Jitteriness and poor feeding. C. Increased thirst. D. Steady weight gain. Answer: jitteriness and poor feeding. Rationale: jitteriness and poor feeding are early hypoglycemia signs in infants. Option B is correct. Options A, C, and D suggest normalcy or hyperglycemia. 91. Which milestone should a nurse expect in a healthy 4-year-old child? A. Skipping with alternating feet. B. Reading chapter books. C. Solving math equations. D. Writing full paragraphs. Answer: skipping with alternating feet. Rationale: at 4 years, children typically skip, showing gross motor coordination. Option A is correct. Options B, C, and D are advanced skills, 6+ years. 92. What is the best way to assess fever in a 6-month-old infant? A. Use a forehead strip only. B. Take a rectal temperature. C. Ask the parent to estimate. D. Check skin warmth by touch. Answer: take a rectal temperature. Rationale: rectal temperature is most accurate in infants under 3 years. Option B is correct. Options A, C, and D are less reliable or subjective. 93. Which symptom suggests appendicitis in a 10-year-old child? A. Diffuse upper abdominal pain. B. Right lower quadrant pain. C. Chronic back pain. D. Mild headache. Answer: right lower quadrant pain. Rationale: appendicitis typically causes RLQ pain, e.g., McBurney's point in children. Option B is correct. Options A, C, and D suggest other issues or are nonspecific. 94. When should a child receive their second MMR vaccine dose? A. 6 months. B. 12 months. C. 4 to 6 years. D. 10 years. Answer: 4 to 6 years. Rationale: the second MMR dose is given at 4 to 6 years per CDC for sustained immunity. Option C is correct. Options A and B are too early. Option D is too late. 95. How should a nurse administer IM injections to a 3-year-old child? A. Use the deltoid muscle. B. Use the vastus lateralis. C. Inject in the gluteus maximus. D. Avoid IM injections entirely. Answer: use the vastus lateralis. Rationale: the vastus lateralis is the preferred IM site in young children for safety and muscle mass. Option B is correct. Option A is for older kids. Option C risks nerve damage. Option D is impractical. 96. What is the best pain management for a child with sickle cell crisis? A. Cold packs and acetaminophen. B. For hydration and opioids. C. No pain relief needed. D. Aspirin and rest only. Answer: for hydration and opioids. Rationale: sickle cell crisis requires 4 fluids for hydration and opioids for severe pain. Option B is correct. Option A is insufficient. Option C neglects pain. Option D risks bleeding, aspirin. 97. What should a nurse do first for a child post-tonsillectomy with bleeding? A. Offer ice chips immediately. B. Assess airway and notify MD. C. Encourage swallowing blood. D. Apply heat to the throat. Answer: assess airway and notify MD. Rationale: bleeding risks airway obstruction. Assessment and MD notification are priorities. Option B is correct. Options A, C, and D delay care or worsen bleeding. 98. What is the priority action for a child in cardiac arrest? A. Give rescue breaths first. B. Start chest compressions. C. Check temperature first. D. Wait for a defibrillator. Answer. Start chest compressions. Rationale. In pediatric cardiac arrest, compressions restore circulation immediately, CAB sequence. Option B is correct. Option A delays circulation. Option C and D delay care. 99. How should a nurse address a parent's concern about picky eating? A. Force feed the child. B. Offer tips for variety and patience. C. Tell them it's not a problem. D. Suggest skipping meals. Answer. Offer tips for variety and patience. Rationale. Encouraging variety and patience addresses picky eating constructively. Option B is correct. Options A, C, and D risk nutrition issues or dismiss concerns. 100. What should a nurse do if a child's treatment consent is unclear? A. Proceed without consent. B. Clarify with parents and document. C. Skip the treatment entirely. D. Assume consent is implied. Answer. Clarify with parents and document. Rationale. Nurses must ensure informed consent is clear, documenting discussions legally. Option B is correct. Options A, C, and D violate ethics or neglect care.